Alex Lawson, the founder and director of Social Security Works, weighs in on how the coronavirus pretty much makes the case for Medicare for All. Plus, talks about the ongoing Republican war against Social Security, Medicaid, and Medicare. Check it out. Leave your comments, ding the bell, share it with your friends, and subscribe to our channel. Back, Thom Hartmann here with you. On the line with us is our old buddy Alex Lawson, the executive director of Social Security Works, the owner, host, and producer over at We Act Radio in Washington, D.C., our D.C. affiliate. SocialSecurityWorks.org is the website. ALaw202 is Alex's Twitter handle, as well as SS Works. Alex, welcome back.
Thanks for having me, Tom.
I wanted to talk to you about two different things today, Alex, if we may. First of all, or actually second, we'll get to that in just a second. I want to find out what the state of the war against Social Security, Medicare, and Medicaid by the Republican Party is. But first, we had Larry Cohen on a little earlier in the program from Our Revolution, and he was mentioning, and it's been said before, I think it's almost self-evident that the probably the strongest ad out there right now for Medicare for All are the news stories about this coronavirus. Can you break that down and distill it and present it as a cogent argument that people can take and carry into their conversations with others?
Tom, I can try. You tell me, though. I think the starting point that everyone should just recognize, and I think we all know this, is that even when everything is kind of right and set up correctly, it's still hard to have people do the right thing often when it comes to their health, and especially when it comes to scary things around their health. Meaning that even if you have freely accessible health care or universal testing for the virus that causes COVID-19, which I'll just call COVID-19, people still don't run to get tested because there's a sort of humanness here. It's fear. It's scary. It's a pandemic. The news is hitting us from all sides, and it really, really means that people sort of retreat away from this.
Well, and going to the doctor's office is not something people do for recreation.
Exactly. That's what I mean. Even if it was all set up so that you could just show up, get tested, get treatment if you need it, it's still actually hard to get people to do that because taking care of our health is a scary thing sometimes. So in the midst of a pandemic, I would say it's sort of all the time. So add on to that the fact that, if you go to the doctor's office, you might owe some astronomical amount of money if you find out you are sick. Or there aren't any tests right now because our broken system, it's not broken, it just is not a healthcare system, does not actually have any incentive set up to find this bug, to identify how widespread the epidemic in the U.S. is. And that's what we're looking at. Even if we did have those tests and, some people have insurance, that's true. Even if the U.S. government tells the insurers that they have to make sure that they're providing treatment or access, we still have tens of millions of people who don't have insurance. We have tens of millions of people who interact with basically the entire population of this country every day that we rely on for the functioning of this country. The folks who make our food, the folks who serve food, the folks who make things with their hands, teachers, the people who look after children. We are not able to actually address infectious disease like COVID-19 unless everybody is able to get tested and get treatment. And then I'll just kind of end this piece with, even if if testing was universal, but someone didn't have insurance and it was unclear that they would get the care that they need, or if they did, that it wouldn't bankrupt their family or themselves, you are going to see people who are not going to find out. They're not going to go and get tested because they don't want to know, because in their minds, what's the point of knowing if there's no treatment option, or if the treatment option means that they're going to bankrupt themselves or their family?
Yeah.
Our system is perfectly set up to not address a pandemic.
Yeah, absolutely. And then you've got the situation of this guy down in Florida that's gotten a fair amount of publicity. He actually had contact with somebody who had been diagnosed with coronavirus, and therefore he qualified under the CDC guidelines, these very, very strict guidelines, when, a few days ago when the United States only had 1,500 test kits for the entire country to be tested. And so he went to the local hospital. His doctor said, go, present yourself at the ER. He went to the ER. They did the test on him. It came back negative. He went back home, and 3 days later, he gets a bill for $3,600 in the mail. And that does not yet include the cost of the emergency room. This was just the doctor and the ambulance to get him there, or whatever it was. I mean, this is only the partial bill. And his insurance, he's got an Obamacare policy with a $5,000 deductible, so he's got to pay it.
And that news story is everywhere, right?
Yeah.
So people see that news story and they say, well, I don't have $3,600 sitting on the side, right? We know that the vast majority of people don't even have $400 banked for an emergency. Yep. And so that is going to make it almost impossible to get the testing at the scale that we need to address a pandemic. So let's flip over to the reality that we want to build, where you have a Medicare For All system, right, where everybody has access to all the diagnostic tests and the treatment if they need it, right? Even in that system, addressing a pandemic would be hard, but we would be able to eliminate people who eliminate the idea that you shouldn't get tested because you can't afford the treatment if you test positive. People would get the care that they need. Also, in one system, the data that would be coming in, because there's only a single payer, and it's not a bunch of corporations trying to profit off of each other by siloing their data and monetizing it and financializing it. It's actually the data is all being used for public health reasons. We could find those hotspots. We could identify them before the epidemic in a localized epidemic spreads. Just imagine the difference. Right now, it's literally operating in the dark. The federal government can kind of throw out some money incentives, but it's relying on a completely fractured system of businesses who are all competing against each other. So that is not a system that is set up to address a pandemic of a novel bug like we're seeing with COVID-19.
Right. Providing health care is not like making cars, but we're using the for-profit competitive system of making cars to provide health care, and it's insane. We're talking to Alex Lawson. He's the executive director of Social Security Works, socialsecurityworks.org. So, Alex, what is the state of the current state of the Republican war on Social Security, Medicare, and Medicaid? I know in Trump's last budget, which he dropped, a month ago or so for next year, that budget has multi-billion-dollar cuts to all three of these programs. But in addition to that, what else is going on? And maybe you have some specific details about that.
I mean, close to $1 trillion out of Medicaid, right? Like, that's the vision that his budget has. Devastating cuts to Medicare, devastating cuts to Social Security. But we also know that that's his blueprint. That budget is not actually going to be enacted. But what we are seeing in the rulemaking side, which is completely under his control, the rulemaking all happens in the executive, is this sustained and continuous assault on Social Security like we've never seen before. And it's just grind. I can't tell you how sort of heartbreaking / just enraging. I get emails and messages, and they're from people who are terrified because they're following along and they're wondering, they're asking me, like, is the Trump administration going to rip my benefits away? Because I just don't know if I can survive without my disability benefits that I need to literally survive. And I just got an email like this the other day, and the panic and it was just so enraging that this is what the government, the U.S. government, is spending their time on, is actually coming up with new and novel ways to steal the benefits of people who have earned them. So we just hit the fourth rule change. And I don't want to go too deep into the weeds on it, but what they're doing is they're just making it harder and harder to not only qualify to get Social Security benefits, but also once a person gets them, they're coming up with ways to take them away from them. And we're sort of, I've used the Avenger movies metaphor. We're coming up on the end game here. There is one giant rule change coming up. It's shorthanded grids, but we're working on how to actually tell people exactly how it works. But the end of it is to just massively restrict the ability of the American people to access their earned benefits. And it's all being done in this really sort of below the radar way. And it's at the same time that, people are going to be needing their benefits more as we're facing this economic turmoil from the pandemic. But they're still pushing and doing everything they can to steal our benefits. It's sickening, Tom.
Yeah, it truly is. And for people living on Social Security disability, it's scary as hell. And also, Trump has scaled back hiring. I mean, he's done this with the IRS, too, now, to the point that the IRS is no longer auditing rich people. They can't afford to. They don't have enough people. He's scaled back hiring for Social Security and Medicare, so it takes longer, not even disability, but it takes longer to just, sign up for Social Security and Medicare. Do I understand that correctly?
Absolutely. And it's not just, it's a full-scale assault. David Black is the deputy commissioner, and he's basically the union buster in chief. They did it at the VA. They're about halfway through it and at the Social Security Administration. So they're just it's an assault on the workers in the administration, the people who have all the institutional knowledge to make this system function for the American people, which, by the way, just to say, we pay for it. None of the money is coming out of the general revenue for the salaries of the people who work at SSA. That's all coming out of our premiums that we pay in with our paychecks, just like our benefits. We pay for all of it.
Right, and
they're actually taking away.
And their plan, forgive me, I'm interrupting, we have 6 seconds. Their plan is to break the system so that the banksters can come in and say, we'll provide you with a privatized one, just like Medicare Advantage. It'll be wonderful, right?
Exactly. That's their game plan over and over again. They break the system and then complain that it's broken and then sell it off to their cousins on Wall Street.